dealt with allergies, chances are you've come across this name before. Today, we're doing a deep dive into levocetirizine, the modern allergy fighter that's probably sitting in a lot of our medicine cabinets.
You know the feeling, right? The runny nose, the itchy eyes, the endless sneezing. We've all been there. But have you ever actually stopped and wondered what's happening inside your body when you pop that little pill? How does it really work? Well, let's find out.
So, let's meet the star of today's show, levocetirizine. This is a go-to for all kinds of allergic reactions. Our goal in this explainer is to break it all down, what it is, how it works, and most importantly, how to use it safely and effectively.
Okay, so you hear levocetirizine get called a modern allergy medicine all the time, but what does that actually mean? What makes it so different from the older options, and why does that matter for you?
Well, here's the key. It's what we call a second-generation antihistamine. And honestly, this is a huge deal. The first-generation stuff, the older allergy meds, they were famous for knocking people out, making them super sleepy. This new class was specifically engineered to fight allergy symptoms without all that drowsiness. That's exactly why it's become such a popular choice for daytime relief.
So we know it's a modern antihistamine that's less likely to make you want to take a nap. But how does it actually, stop a sneeze in its tracks? Let's dive into the science behind it.
Okay, this is actually pretty cool. Think of it like a lock and a key. Your body's cells have these little things called H1 receptors. Those are the locks. When you have an allergic reaction, your body releases histamine, which is like the wrong key trying to jam itself into that lock and set off all your symptoms. Levocetirizine is like the perfect key. It gets to the lock first, fits in nice and snug, and just blocks histamine from ever getting in. No histamine, no symptoms. Simple as that.
So once you take it, the medication goes on a little journey through your body. Scientists have a fancy acronym for this, ADME. It stands for absorption, distribution, metabolism, and excretion. Let's follow that path and see what happens at each stop.
So, what does this whole four-step journey mean for you? Well, absorption is super fast, which means you feel relief pretty quickly. Distribution is smart. It avoids your central nervous system, and that's the main reason it's less likely to make you drowsy. It's only minimally metabolized, which means its effect is really predictable and reliable. And finally, excretion. It leaves your body mostly through your kidneys. Now hang on to that last point. It's going to be really important in a minute.
Okay, which brings us to the really practical part. How do you actually use this stuff? Getting the dose right is absolutely critical, not just for it to work well, but also for it to be safe.
You'll often see levocetirizine in a liquid form, like a syrup or drops, and there's a good reason for that. It lets you be super precise with the dose, which is so important when you're giving medicine to kids of different ages and weights. It just helps make sure they get exactly the right amount.
And as you can see here, the standard once-a-day dose changes a lot depending on age. It starts off really small for toddlers, then it doubles for older kids, and then it doubles again for adults. Getting this right is absolutely key.
Now, remember how I said to pay attention to the part about the kidneys? Well, here's why that's so important. If someone's kidneys aren't working at 100%, what doctors call renal impairment, the drug can't get cleared out of the body properly. So for those people, the dose has to be adjusted. And in really severe cases of kidney failure, it shouldn't be used at all.
And that brings us perfectly to our last and probably most important section, safety. Understanding the risks and precautions is just non-negotiable for using any medicine wisely.
Let's be super clear about this. On one side, you have side effects. These are usually pretty mild things, like a little bit of drowsiness, a dry mouth, maybe a headache. But on the other side, you have contraindications. These are the absolute deal breakers. You should not take this drug, period, if you have severe kidney failure or if you know you're allergic to it.
And here are just a few other really important precautions to keep in mind. You want to use it with caution if you're an elderly patient. You definitely want to avoid alcohol. It can make that mild drowsiness way worse. And for that same reason, just be careful when you're driving until you know for sure how this medicine affects you personally. And of course, always tell your doctor about any other meds you're on that affect your central nervous system.
Okay, phew, we've covered a lot of ground. So if you were to boil it all down, what are the most critical things to remember to stay safe and get the best results from this medicine?
Let's end with this simple but really powerful safety checklist. Number 1, always tell your doctor about any kidney problems. Number 2, don't mix it with alcohol or other sedating drugs. Number 3, stick to the exact dose for the right age. And just a helpful little tip, you can take it with or without food, which makes it super easy to fit into your day. Following these steps is really the key to using this modern allergy fighter in the smartest, safest way you can. And being informed is the best way to manage your health. So maybe think about what questions this brings up for you to ask your doctor next time.